Welcome to University Hospital's Portage Medical Center, a magnet-designated hospital. We are excited to showcase our clinical nurse specialist group. Our team includes Jan Bale, Cindy Majersic, Lena Schutte, Ruth Ludwig, and Valerie Hennessy. Also featured in this video is Lisanne Bright, Director of Nursing at an agency who provides services to individuals with developmental disabilities, and Jody Mullen. First, we would like to describe the role of the Clinical Nurse Specialist, or CNS. A CNS is an advanced practice registered nurse that provides clinical expertise to ensure quality, cost-effective patient outcomes. We support nursing practice and optimization of system processes through innovation, evidence-based practice, and research. The CNS has a unique role to integrate care across the continuum and through three spheres of influence: patient, nurse, and system. The three spheres are interrelated, but each sphere possesses a distinctive focus. The primary goal is continuous improvement of patient outcomes and nursing care. Next, we want to share an example of our innovative intervention and care coordination efforts. The goal of the At-Risk Care Plan is to improve safety and quality care by proactively anticipating individual safety and care needs of patients at risk and to communicate those needs to the healthcare team.
Hospital readmissions and adverse events, as many of you know, are focused targets for improvement across hospitals today. Nurses, the largest profession of direct care providers, have led innovative care coordination efforts in preventing both readmissions and adverse events. With increasing patient care complexity and increasing costs, nurse-led creative care coordination is vital to effective healthcare reform.
The At-Risk Care Plan was designed to provide better care coordination for patients with complex needs and who are often high-end users of costly services. Finally, the CNS team has expanded their care plan work with individuals who have intellectual and developmental disabilities, or IDD. We will now share our involvement with the IDD group.
Hello, Lisanne. It's so great to finally get to speak to you face to face.
Yes, it is.
Have a seat.
Thank you.
Thank you so much for contacting me regarding Patty Patient while she was under our care at University Hospital's Portage Medical Center. Our conversation was pivotal in improving the care we deliver. The more we spoke, the more it became apparent there was an opportunity to improve our care, not only for Patty's needs, but for the needs of all of our patients that have intellectual and developmental disabilities. That's when I realized I needed to connect you with our clinical nurse specialists, not only to facilitate staff education, but more importantly to improve the continuity of care during hospitalization with our innovative at-risk care plan process.
I want to say thank you for facilitating this work stemming from our conversation about Patty Patient. All individuals receive care based on their identified needs. However, the residents that I oversee all have a few common characteristics that can be manifested in different manners. Recommending an at-risk care plan for Patty changed the course of her hospitalization stay. Jan, Cindy, and Lena worked with me as we collaborated and designed an at-risk care plan specific for Patty.
Hi, Jody. Do you have a minute to talk about this at-risk care plan on Patty Patient?
Yes, I'm excited to talk to you about the care plan. What a difference it made knowing that IDD patient liked Gilligan's Island reruns. We put those on for her. It made it better interaction between the nurse and the patient. It was wonderful. She laughed, giggled, and she had a good time with us. We also learned that she had a nickname, Patty Pancake, and once we started calling her Patty Pancake, she responded to us much easier and more comfortable. It made our interactions terrific. From the care plan, we learned how very important it was to approach her slowly, calmly, and explain all hands-on care before we actually did the treatments. And that just decreased her anxiety level for us. We tried to mimic what was done in her group home to make her more comfortable.
Oh, wow, that's great. It sounds like the utilization of the care plan and knowledge-based charting was a valuable communication tool for all the staff caring for the patient.
And one more thing, having the number to the on-call nurse at the group home made a world of difference. She was a great resource for us.
Oh, great. Thanks, Jody.
You're welcome.
Thank you for your interest in the clinical nurse specialist role. We enjoyed sharing this example of the innovative ways the clinical nurse specialist can impact your facility. To learn more about this advanced practice nurse role, please visit the National Association of Clinical Nurse Specialists, NACNS, website at www.nacns.org, or the Northeast Ohio Clinical Nurse Specialists, NEOCNS, at www.neocns.org. To read the full publication on at-risk care plans, visit the Journal of Nursing Care Quality, Volume 30, Issue 1. To learn more about the University Hospital Systems, please visit uhhospitals.org. Thank you again, and we hope that you have enjoyed learning about us.